Welcome back to my channel. Why do people mask suicidal thoughts? I did want to start off, if you're new to the channel, know my mask has nothing to do with COVID-19 masking or a masquerade ball. It has everything to do with hard topics that are considered taboo and often are stigmatized, such as suicide, suicidal thoughts, mental illness, depression, mental health, anxiety. I wanted to start off to give you a disclaimer that I am not a licensed therapist. I am not a licensed psychiatrist, psychologist, or a licensed coach. I am simply a woman who have experienced living through these traumatic events, such as suicide, suicidal thoughts, depression, anxiety, and mental health. So I'm using the mask as an example as why we mask our true identity, because mental illness is often stigmatized and we feel that we're weak if we let someone know that we're struggling. But I'm here to educate you that no, you're not weak. You're experiencing a mental health crisis that requires attention, and help is available. So on yesterday, I said I started a virtual series, to go to a road trip with me. And we started at Ground Zero and we started at Psychology Boulevard. And today, what we're going to start as Psychology Boulevard. So we can break down the three different specialists that are trained to help you to get you back on track. I wish I would have knew some of these things before my mental illness. So I just wanted to share with you and hopefully inspire you and encourage you to speak out when you are having a mental illness crisis. Help is available, and no longer suffer in silence with your suicidal thoughts, because once you suffer in silence, then you get isolated, and then you want to make a permanent decision for a temporary problem. So it is my goal, my hope is to inspire you to unveil your mask. These are just examples of what we do when we go before our friends and family and we mask the hurt, the pain, and the suffering that we are enduring. So I wanted to start, like I said, at ground zero so we can understand some of the specialists that we have to help you. So we are at Psychologist Boulevard today. When you think of a psychologist, think counseling and therapy. Psychologists have their own doctorate in psychology. They have been trained to listen carefully, diagnose a mental disorder, and develop a treatment plan in collaboration with you. They are trained to help you heal pain and solve the problems that get in the way of your quality of life, dreams, and goals. With your permission, and if appropriate, they may also work with your family members and others who may be involved in your treatment plan. Therapists, like psychologists, are unable to prescribe medication. A therapist's goal is to help a patient to make decisions and clarify their feelings and emotions in order to solve problems. Therapists provide support and guidance while helping a patient make effective decisions within their overall structure of support. And when you think of psychiatrists, think of medication. Psychiatrists are medical doctors, MDs, who specialize in mental health. During your first appointment with a psychiatrist, they will ask you to describe your problem, give you a diagnosis, and if you have one, and usually will discuss medication options with you. Follow-up appointments are usually less than an hour and are focused on how you're doing on the medication. Psychiatrists will assess whether you're on the right medication and the right dosage. Now, I did want to explain not everyone needs medication. Some people may just need a psychologist or a therapist just to counsel you and identify the areas that are crippling and disabling your life. So, I just wanted to give those distinct differences of your options that you have to treat you. So, it is imperative if you are having a mental health crisis, help is available. I just broke down 3 options that you have to contact. So, also, if you are struggling with suicidal thoughts, the Suicide Prevention Hotline is available 24 hours, 7 days a week. They can be reached at 1-800-273-8255. The reason why I know that number so well, because I utilize that number myself to get help, and they have saved my life and encouraged me to keep moving. So again, I want to be your living witness that help is available, hope is available. Hope gives you the being optimistic that something is better on the other side. I know you may not be feeling like it is, but it is. If you get the proper treatment plan, follow the doctor's recommendations, you can begin to unpack your traumas, learn to live with your mental illness. So again, I just wanted to inspire you and encourage you to not suffer in silence, to reach out. And it's okay not to be okay, but it's not okay to stay that way. Let people in. Let them know that you are struggling. Reach out to positive friends and family and let them know that you are struggling with your mental health. You're not crazy. It's called a mental illness that can be treated. 90% of mental illness cases have a treatable diagnosis. However, you need to reach out to the proper specialist that we just went over so they can begin to unpack and provide you a treatment plan specifically for you. And again, not everyone needs med management. You may need just counseling and unpack the feelings and emotions that you are experiencing. So again, my hope and desire is to give you hope. I am a suicide survivor. I live with a mental illness and I live today. And my hope is to give you hope to continue to fight for yourself, speak up, and no longer be embarrassed that you are having a mental crisis. It's no different from someone who have heart problems or they need heart medication. You have a mental condition of the brain. I want to leave you with this. Your now is not your forever. And I know your story because I myself lived it. So tomorrow, I plan to come on the channel and where we can discuss some of the mental illness. What is mental illness? And we'll be able to unpack some of those things where I'll be able to educate you and hopefully get you on the road to recovery. And please, please do not suffer in silence. You're not alone. Suicide is the second leading cause of death for kids 10 to 14 and 25 to 34. And it's the ninth overall cause of death for ages 10 to 64. And that's according to the CDC Gov latest statistics in 2020. So you're not alone as far as feeling anxiety, depression, but help is available. And it is my goal to use my own testimony, my own story to give you hope. I am your hope. I have been diagnosed with a mental illness. I have overcome suicidal thoughts with therapy. I've been in therapy for 12 years. I continue to be in therapy. I continue to follow my doctor's recommendations, taking my medication, and seeing my therapist. I leave you with this. May God keep you. May God bless you. And until the next time, thank you.